Okay, could you share your name with us first?
My name is Fred Russell.
And Fred, thank you for coming. And what's your healthcare story?
Well, I'm self-employed. After working for corporate America for about 30 years, I'm self-employed now. And since that time, I've had Blue Cross Blue Shield insurance. I pay quite a bit for that insurance. I'm currently paying $900 a month for that insurance. And my big problem is when I go to use insurance, each time I have a huge difficulty in using it. It's a very complicated to work through the system to be able to use insurance. 2 months ago, I had surgery, and everything worked out fine. I went through all the steps to use insurance. But now my big concern is that my insurance is time to renew it come November. I know they're going to jack this rate up. I'm already paying $900 a month. I can't imagine what it's going to be. So my push is to get this here insurance company, get the insurance, get it resolved, get it fixed.
And the $900 covers just yourself?
Myself and my wife,
Okay.
just two of us.
Okay. And how was navigating through your surgery with your insurance company?
Well, it worked out pretty good for me, but my wife, she's in healthcare. She's a nurse. She's a quality nurse, so she knows all the steps. But still, it's very complicated, and without her, it'd be very, and I'm an aerospace engineer, so I'm pretty good at some of this stuff, but it's
Right.
still very difficult.
Okay.
And I hate to think some of my brothers and other relatives going through the same stuff I go through. It's complicated.
And if you had the opportunity to share with the administration, Congress, what would you want them to do with healthcare?
A couple things. I'd like to see them fix the private insurance companies. When I say fix it, get it so folks can afford it. So middle class people can afford it. I mean, $1,000 a month is way too much to pay for insurance, particularly if it's difficult to use. That's one thing. Also, I like to see them fix it so you can get the medicines without paying a huge amount. Like if I go to get my cholesterol medicine, sometime it may be $200.
Wow.
And I'll get some of it
Per month?
reimbursed. Yeah, no,
Okay.
it's not. I'll get some of it reimbursed, but it's one of these difficult things. You go to Walgreens, you pay $200. Then a couple weeks later, you get a check back for $100. It's rather complicated. So that's one thing. But more importantly, I like to see a public plan that I can count on getting. There's no guarantee I'll have insurance next year. If they jack it up to like $1,500 a month, I'm not going to be able to afford it.
Right.
And that's crazy. So I like to see a public program that I can count on as part of the government that we can go get good insurance and be able to use it, and simple to use.
Okay. Well, thank you very much for sharing your healthcare story.
Okay, great. Thank you.
Thanks, Fred. Appreciate
Is
it.
that all right?